What does treatment look like if you have bipolar disorder and are pregnant or have recently had a baby? How might this differ from your current treatment plan? What happens with your medication now that you're pregnant or while you're breastfeeding? It is completely normal to worry about how your pregnancy can influence your life and your mental health. In this video, we explore treatment options for bipolar disorder in pregnancy and postpartum and how your healthcare provider can help you find a plan that works for you. Ideally, your pregnancy journey involves early pregnancy planning and consistent postpartum care to prevent relapse. Adhering to the treatment plan and regular check ins with your doctor helps ensure that any needed adjustments to this plan are made quickly. The recommended treatment for bipolar disorder in pregnancy and postpartum depends on factors such as the type of symptoms you have experienced or are currently experiencing, such as depression, previous responses to medications, and personal preferences. Keeping a daily mood and symptom journal for a week or two before appointments and writing down any questions can help you and your provider make an informed decision together. Generally, the primary treatment for bipolar disorder is medication, regardless of the severity of symptoms. It's important to have a discussion with your healthcare provider about your medications because pregnancy can sometimes alter how your body processes medications. This means you might require dosage adjustments during the pregnancy and shortly after delivery. For certain medications, your healthcare provider may recommend extra monitoring of you and your baby to ensure you both remain healthy. There is also a bipolar disorder medication, valproate, valproic acid, or D-valproex, that is usually not recommended in pregnancy. If you are taking this medication, your healthcare provider may suggest that you change to another one. Sometimes people with bipolar disorder wonder whether they should stop their medication during pregnancy or after delivery, out of concern for the baby. However, not taking medication increases the risk of relapse if you have bipolar disorder. The postpartum period is an especially high-risk time, with a 66% risk of relapse without medication compared to 25% when medication is continued. Because of this, for people with bipolar disorder who are doing well, healthcare providers usually suggest continuing medication during pregnancy and postpartum for maintenance and relapse prevention. Ultimately, the decision to stay on your current medication or switch to another mood stabilizer is yours. Your provider can also go over the potential benefits and safety considerations for each option and support your decision-making process. Some non-medication interventions can also be helpful alongside medication for mild symptoms of depression and for preventing relapse in bipolar disorder. Getting enough sleep is essential, since sleep loss can trigger mood episodes. Support from family, partners, and the community can also help with daily routines and reduce stress. Peer support, especially by trained peers with lived experience, may also help with relapse prevention. Some research supports psychological therapies such as cognitive behavioral therapy, interpersonal and social rhythm therapy, and family-focused therapy for improving mood stability and sometimes preventing symptoms from coming back. These have not been specifically tested in pregnancy and postpartum, but have been tested in bipolar disorder in general. For people who are experiencing symptoms of bipolar disorder in pregnancy or postpartum, medication is also the first-line treatment option. Your healthcare provider can review which medication is safest and effective for your situation. Depending on how severe your symptoms are, your healthcare provider can help you and your care partners decide whether recovery is best managed at home or in a hospital. People with bipolar disorder are also at higher risk than people without bipolar disorder of experiencing postpartum psychosis. For details about the symptoms and treatment for postpartum psychosis, see our CAMAT postpartum psychosis video. If symptoms worsen, are prolonged, or get in the way of caring for yourself or your baby, contact your doctor to discuss possible treatment adjustments. If in crisis, such as having suicidal thoughts, call or text 988. If you feel in danger or are thinking of hurting yourself or your baby, or someone you care for is experiencing mania or psychosis, call 911 or go to the nearest emergency department.